Greetings, ladies and gentlemen. I'm your host, Mo the author, and welcome to Chat with Mo. Tonight's topic is stress. We will be discussing work stress and mental health. According to the National Institute for Occupational Safety and Health, abbreviated NIOSH, work stress refers to the harmful physical and emotional effects when job requirements do not match workers' resources or needs. Work stress can lead to poor mental and physical health. Mental health includes a person's psychological, emotional, and social well-being and affects how we feel, think, and act. So, NIOSH, as in the National Institute for Occupational Safety and Health, addresses the mental health of health workers due to an extensive cross-disciplinary research portfolio, collaborative partners across the United States. One of their goals of NIOSH is to raise awareness of mental health issues, including the risk of suicide and substance use disorders, to also eliminate barriers to accessing care, identify workplace and community supports for health workers. Last two items we will mention. Their goal is also to reduce stigma related seeking and receiving care for mental health. Identify and improve data, screening tools, trainings, resources, and policies to address health worker mental health. So, let's talk about stress in the workplace, particularly healthcare. So, what issues do you think cause stress in healthcare? We all are aware of what's going on with the pandemic or pre-pandemic, post-pandemic, or just pandemic altogether. Do you know anyone who works in the healthcare field? What tidbits would they share with you? Would they say that they're overworked? I'd say yes. Would you say they're underpaid? I say yes as well. Do you think they are equipped? Do you think healthcare workers was equipped for the pandemic regarding the coronavirus and the different variants that we have encountered here in the U.S. and overseas? So, for healthcare workers, regarding their stress levels, and we all are aware when it comes to high blood pressure, low blood pressure, what this number should be. I'll post that in the after the end of the video to be sure that we're all aware what our number should be. So, for healthcare workers and many of us, working conditions can be challenging, and we're aware of that. Why? Because the stress level is extremely high, and the situations that healthcare workers experience regarding the emotional well-being. So those who have been in car accidents, those who have traumatic experiences, even delivering a baby, especially those who work in the emergency room, they encounter a variety of health conditions, not just the normal headache or nauseating experiences or vomiting, things of that nature, but they experience cardiac arrest, which can be very scary, car accidents that can lead to death. They experience domestic violence situations, rape. It's a variety of things that they encounter in the healthcare field. So, healthcare workers, their mental health issues are increased because they're exposed to human suffering a lot and death on a daily basis. Recently, I did a study on how car accidents occur, like almost 6,000 deaths a year actually occur. 6,000 deaths a year occur from car accidents because individuals are sleeping. Why is someone sleeping while they're driving? They're exhausted. They may be overworked, not getting enough rest at night. They may be stressed out. So they get behind the wheel thinking they can make it from A to B, and sometimes it doesn't happen that way. There not only has the COVID-19 impact healthcare workers, but there's other diseases that they are impacted by. Hazardous drugs, HIV, AIDS. I'm working on not doing that. It's so many different infectious diseases out there, not just HIV, AIDS, or the COVID-19. There's the flu, there's pneumonia, different diseases that people can get simply coming in contact with one another in different ways. I'm not going to list every infectious disease that there is. It's several, so I won't go down this entire list. However, back to our topic at hand regarding stress and mental health. Sometimes in healthcare and other fields, we work long and unpredictable scheduled hours. I remember having to work 16-hour days, 12, 14-hour days, and I may be off one day. And oh my goodness, it was stressful. It was tough. I remember going home from work one day. I'm not even sure how I got home because I was just really that tired, but I made it. And I remember taking a shower and going back to work. I don't remember going to sleep. It was just almost like I went to work, went home, and went back to work. It was just like, go to work, take a shower, go to work. And somehow in there I went home. I don't remember going to sleep at all. So, think about your job. Is it unstable? Do you have unpredictable work hours? Is it financially straining you? Are you making enough income to meet your needs? If not, we may need to evaluate that. I recommend you getting you a career coach or talking to a counselor to assist you in shifting your career. So, currently, I think this is across the board. Healthcare workers, as well as other people not in the healthcare industry, in the food industry, education industry, they have a heavy workload, as well as dealing with staffing shortages all over. Recently, I had a conversation with someone, and they explained to me there's over 43 to 44 million individuals left their jobs when the pandemic occurred. And although the job market has changed, a lot of people are entrepreneurs. It left companies in a deficit. Partially that was because the requirements for people to be vaccinated. Some people were retiring. Some people really felt they were led to leave their jobs because of their calling, their purpose. They wanted to fulfill that. I don't discourage anyone from pursuing their calling, walking in their purpose. If you feel led to do so, go for it. Do it. Now, there are other aspects of this when it comes to mental health workers and those people who are outside the healthcare field. I'm going to read this quote to you all from the NEOSH website. It says, some healthcare workers report symptoms consistent with post-traumatic stress disorder related to the pandemic. Some also reported residual symptoms due to personal infection with COVID-19. Have you had COVID-19? Well, how did it impact your family? How did it impact your job? For me, when I received that diagnosis, I was out of work for an extended period of time. And thankfully, the company I worked for compensated me, which I'm grateful for at the time they did that, which was a blessing to me. However, people who are dealing with post-traumatic stress disorder, we know that's a mental health disease, mental health disorder. Is most commonly associated with military people. However, you can have PTSD and not be in the military. Some people have PTSD from driving, having bad car accidents. They may have nightmares from being raped or assaulted, being falsely accused and arrested. Even some things dealing with this whole coronavirus. Some people mentally, I can recall people stressed and worried, having to adapt. Some people are used to being outside, out and about, shopping and going places. Then they had to shift their lifestyle because they felt like they were locked in their homes, trapped in their homes. There were those people who had to work from home, who were used to interacting with others. That was a complete shift. There were those who liked working from home and enjoyed it. However, for those individuals who enjoy being around people, this was a complete overhaul. The churches was impacted because they had to learn how to adjust to have virtual services using Zoom, Microsoft Teams, Facebook, really using technology to reach the masses. Now, so how are you? Was that stressful? Indeed, it was very stressful for a lot of people. So how has the pandemic impacted you? What are your stress levels like? Did you begin to eat more? Did you work out less? Did you develop new hobbies, new ideas? Did you launch a business? How did you handle the change? How is your mental health? What's going on with your stress levels? Did you become a diabetic, a pre-diabetic? Or did you decide, I want to take control of my life. I want to decrease my blood pressure to become a healthier individual, to live longer for myself, for my family? What was your choices? Think about it and decide what did you do to improve yourself. I know someone who decided to improve their cooking skills. I know others who launched businesses. Then there are a few people who decided they want to be healthier. What did you decide? What remedy do you have to decrease your blood pressure or to maintain it if you don't deal with high blood pressure? Think about it. So when it comes to stress, we are familiar with people who have had a heart attack, who have had a stroke because of high blood pressure due to stress. I've heard of good stress, which is eustress, or bad stress. Which one do you have? Which stressors? What is in your life that you are unable to control? What is in your life that you are able to control? Think about it. Television, movies, your finances, your children, your marriage, your relationships, business, and otherwise. What things are in your life that's stressing you? And what can you do to prevent stress from occurring? A few things I recommend to do to decrease stress. Number 1, only take on what you can handle. I repeat, only take on what you can handle. Number 2, don't say yes to everything. Don't say yes to everything. Sound the same thing? I know, similar, but it's not. Number 3, take a break. Take a break. It's okay. I don't mean to be overly excessive with breaks. If you're not a smoker, they have non-smoke breaks. Take a non-smoke break. Take a step outside and walk a little bit. Stretch your legs, relax your mind, then come back and visit the project again. You'll be surprised how much better you feel. Okay? So we're going to do what? Number 1, we're not going to take on more than we can handle. Number 2, we aren't going to say yes to everything. Number 3, we're going to take a break. And number 4, to help us not to stress, to prevent stress from occurring, I want to tell y'all to say no. But number 4, it's up to you. Being stressed out, that's your choice totally. So you can choose to be stressed or not to be stressed. It is up to you totally. So remember these 4 steps to help prevent you from having high blood pressure and diabetes by not creating stress. Diabetes is not just about stress, it's about your diet. Some diabetes, just a little tidbit for you. Some diabetes can occur through genetics. Some can occur through pregnancy, which is very seldomly. But majority of it occurs through your environment, what you eat, what foods you are placing inside of your body, what you and I are doing. So, again, I'm your host, Mo the author, and thank you for tuning in with Chat with Mo. Be sure to like and subscribe to this YouTube channel to receive updated content on business and lifestyle. Follow us on Instagram at Mo the Author, Facebook at Mo the Author. Visit our website at themoniquewashington.com, and be sure to follow our nonprofit organization, The Worthy Academy, Inc. Thank you for your time and tune in. Until next time, stay up, be blessed, peace.